Hey, what's going on, guys? Dr. Beau here, and today I'm answering your guys' questions all about shoulder pain. This one came in via Instagram, and the person simply asked, "Hey, Beau, I'm experiencing some left outside, so I consider that lateral, shoulder pain. I'm also getting some neck pain and mid-back pain. Do you have any idea what's going on?" Okay, so this is a super common thing that comes in very, very often into the practice. And a lot of the times, patients will say, "Hey, Beau, I'm experiencing pain here, like on the outside," and they think it's an actual shoulder issue. Now, in some cases it is, but in a lot of cases, it's actually not. The number one reason that we get lateral shoulder pain is actually referred pain for our ribs or our mid-back going out of alignment. A lot of times I'll get the history of the patient, and I'll find out they've been doing a lot of pushing, a lot of pulling, maybe like putting things away or working in the yard, doing shoveling. And they'll start to notice that the next day they're getting pain that's here, and it'll start like back here, and it'll radiate out to the shoulder here. And then they think, "Oh, it's my shoulder." When really, guys, it's really not. Now, how do we diagnose shoulder pain? So first off, you have to know that shoulders are the most freely movable joint, I believe, in the body, which means it's not really connected bone on bone to anywhere. Yes, you get a little connection through the front, through the clavicle, but it's freely movable because it's really connected via muscle. So we typically see a lot of shoulder, quote unquote, injuries from overuse injuries, like too much swimming or too much throwing or doing a repetitive motion over and over again. Very rarely do we see it kind of pop up out of nowhere and just say, "Hey, there's lateral shoulder pain." Secondly is the actual site of the pain. For my patients or my athletes that, like I said, are swimmers or overhand sports, they'll say like, "Hey, look, I have pain behind, like in the little crease area of the shoulder here, not so much on the outside of the shoulder." Or they'll say that, "Hey, Beau, I have pain in the front of the shoulder." Or they'll say, "Hey, I notice I am getting a lot of clicking and popping in the shoulder." All of those things can mean different things. It could be rotator cuff syndrome. It could be bicipital tendonitis. It could actually just be the way that the joint is articulating due to muscle compensations in the front of the chest or the back. But very rarely do we notice that there's pain just on the outside portion of the shoulder that's not related to the mid-back region. And then lastly here, when we're talking about shoulder discomfort, shoulder pain, we are going to do different muscle tests to figure out, number one, which muscles are firing or not, but also, is there any radiating pain? Meaning, does it go down into their arms, into their fingers, to their hands? And we do different like little sensory tests. We have them test and say, is this sharp? Is this dull? Can you feel this? Compare left, compare to right. And really what we can start to figure out is not only what's going on with the shoulder, but specifically what areas of the shoulder to dive deeper into, as well as if it is out here, we always look and we'll relate back to the neck and the mid-back region, because very, very often people sleep weird, or like I said, they're doing pushing and pulling, or they've been in a really weird curled up position, and they start saying, "Oh, I got pain on the outside of my shoulder," when it's really not the main site. It's more of a symptom, not necessarily the cause. So if you have shoulder pain, please let me know. Ask down in the comments. If you guys didn't know this, I respond back to almost every single comment that you guys leave here. Matter of fact, it's on my schedule that twice a week I spend 20 minutes and go through all of the comments and I respond to them. Sometimes I'll have 50 to 100 comments, and I literally try to go back and respond to each and every one of those, because the reason I do this is to help you guys. I know many people will go to YouTube, go to TikTok, go to Instagram, wherever you're seeing this at, and they're searching for answers. And that's what I'm doing. I literally go and search keywords, and I ask you guys to submit questions. And then when I get questions that come in, just like this one did, that I think are very relevant or I see over and over again, I try to make a video like this for you guys to learn a little bit from. So if you guys have questions, you have comments about your shoulders, please leave them down in the comments. And like I said, I'll jump in there. I'll help out any way I can. Give you some advice, give you some insights, try to get you guys in the right people's office, wherever you're at in the world. It's crazy. I'm literally answering questions from all over the world. So I really enjoy it too. I feel like I'm being able to help people more than just in my small community here. All right, guys, have a great day. I'll talk to you soon.